it's in the breaking we come unbound. And it's in the giving we are found. Yeah, you could barely change.
Welcome to A Medicinal Mind, Wisdom and Well-Being, a podcast dedicated to the telling of authentic stories and the sharing of insightful wisdom, exploring science and spirituality, medicine and Mother Nature. No topic is off limits when it comes to growing our personal understanding and supporting our collective well-being. With your host, Dr. Rob Abbott, a family medicine resident practicing spiritually focused and evolutionarily informed functional medicine, we hope to nourish your being so that you can flourish in whatever the moment has called for you to do.
And I know you try.
Hey guys, this is Dr. Abbott here, or Dr. Rob as some people have been referring to me as, and I wanted to do a slightly different show today and hopefully try to keep it within 15 to 20 minutes or maybe even less, but wanted to do a little bit of a different show to talk about my clinical approach and highlight an article and case study that I actually wrote a few months ago as part of the Future of Functional Medicine review created by Dr. Michael Ruscio. He's been one of my greatest mentors, and I really wanted to provide sort of an audio component of that article that's on my page and a part of his newsletter, and really kind of highlight the content that he's putting out each month as part of that Future of Functional Medicine review. What aspect of it is a in-depth clinical case review where you're being walked through the presentation of a patient and the thought process and clinical treatment of a clinician. And I was lucky enough to provide a case study for his newsletter, really outlining actually a medical approach that I've adopted from his guidance and what he has put out most recently in his book, Healthy Gut, Healthy You. So this audio is going to sort of coincide with an article. I'll have a link to the case report that you can see that I put up a few months ago to follow along. But essentially what we're going to do is I'm going to start and sort of present a patient as she came into my clinic, and we'll sort of walk through her presenting symptoms. I'll talk a little bit about what was going through in my head, what information I wanted to collect, and kind of stepwise through how we created a treatment plan and what happened with it. And I really, at the end, will provide some clarifying points and some conclusions of what we can learn from this. And I really hope this can help you both if you're a clinician practicing integrative or functional medicine, or even as a patient who is recognizing that a holistic approach is probably more, helpful in terms of the healing process. So without further ado, I'll get started. And the patient in this case was a 70-year-old female who presented to my family medicine clinic. She had a past medical history of hypertension, pretty well controlled on one medication. And interestingly, she had a small bowel or small intestinal lymphoma, which is a type of cancer that she had surgically resected about 13 or 14 years before she had seen me. She had no recurrences of this, had no recurrences of this cancer, and had been cancer-free since. So those are really the two major things in her past medical history, or concerning, but she was coming to see me, sort of seeking a functional provider with her chief complaints and primary issues of what I call sort of vasomotor symptoms, this sort of flushing, hot flashes, even night sweats. Occasionally she would even get headaches, vasomotor headaches, even as well as she'd had some GI symptoms, a little bit of nausea, and even so much as having vomiting. So those were her sort of primary complaints. And they'd been going on for quite a while. She had been working with a primary care provider for some time and was seeking now sort of a second approach. As I collected some information in our first visit, she kind of let me know that she also had some intermittent constipation, more so than diarrhea, occasional bloating, but overall felt that her bowel movements were in general regular, not a huge issue. Like I said, a little bit of bloating after certain meals. All this being said, though, I was a little bit worried given that previous history of cancer, sort of thinking, right, big picture, what are the scary things we don't want to miss, and just dive into a sort of natural approach. I felt pretty comfortable because she had had scans repeat scans that this wasn't an issue about the small bowel with a cancer. But that being said, she had a resection, which is part of that removed. So I'm really kind of worried about the health of her small intestine, both from an absorption standpoint or even problems of dysmotility, which is sort of irregular movements of food. So could the nausea and vomiting be issues with something in the esophagus or even the stomach or upper part of the small intestine, such that she's not moving food through, and that could also manifest as constipation. So that was something I was certainly worried about. Some of you in this space also probably might be thinking small intestinal bacterial overgrowth is a fairly common entity, and in her case, I'm certainly concerned about that, given a little bit of the dysmotility and that previous surgery. Could this be a bit of a setup for creating an overgrowth? All that being said, though, the bigger picture of other things we could be considering more broadly would be, yes, some actual structural obstruction that we would certainly need to rule out via some kind of imaging. She could have just general dysbiosis. Her symptoms could be sort of they sound like female hormone imbalances, so maybe she needs some hormone replacement therapy. But there's something going wrong that we need to examine with her female hormones. She could have some certain nutrient deficiencies. This could be a non-celiac gluten sensitivity. She's still at this point eating wheat. Could these symptoms be contributed to or as a result of issues with digesting wheat or gluten? And as I mentioned before, this could be an issue with estrogen and progesterone, the female hormones, or even something else in her sort of detoxification pathways that's causing some of her symptoms. So there's a broad set of things, but as you're probably picking up on, my approach and in general what I've learned from Dr. Richo is sort of, let's start with the gut. Even though her symptoms seem to be primarily female hormone imbalance related, they could be actually a result of a primary gut issue. And this is a key point I want to make here, that we should not just simply go, even with green medicine or sort of natural approaches, shouldn't just go target the symptoms at the surface level. We really need to look and see, is there something actually underneath that's causing these symptoms? And if we address that, those female hormone symptoms will go away, and we don't need to actually do any kind of therapy for them per se. So as we go forward, that was sort of my first visit with her, and really what we did at that point was focus on lifestyle. So what could we address after this first visit? Now, there has been quite a bit of good published literature about the low FODMAP diet, which I thought she could potentially benefit from, both from sort of a bloating and dysmotility standpoint, and really kind of focus more on a paleo template. She had dabbled in removing dairy, was still eating some wheat products and rice, but I wanted to encourage her to really focus on see if she could stay in that sort of a paleo template and also be a little more mindful of the FODMAPs. And interestingly enough, I actually had her come off of most of her supplements at that point, really wanting to get an idea of, was she needing them? Were they actually helping? Were they doing nothing? Or were they even hurting? She was a little reluctant, but was willing to kind of go along with understanding the concept behind doing this. So I saw her back about 2 weeks later. So we've done basically just the dietary template. And interestingly, at this point, I've only even talked with her about potentially doing blood testing. I'm not even thinking about doing hydrogen breath testing for SIBO. I'm not thinking about doing stool testing. I'm not even thinking about doing Dutch testing or sort of the organic acid testing. I'm not even thinking about doing any of this complex testing. I really just want to focus on the nutrition and maybe do some basic serum chemistries given her hypertension and some of her concerns. So upon that second visit, when she comes back, I dig in and start talking about, well, how are you doing? And she's actually starting to do a little bit better just from the low FODMAP paleo diet. And she's come off of supplements, so she hasn't added anything new in terms of a supplement or a drug. She's really just removed certain foods, focused on certain foods, and starting to feel better. So once again, there's a sign that really we need to put more of our emphasis on the lifestyle piece, and probably do less in the beginning and kind of help guide people along. So that being said, we did talk about in that visit, what can we do from a blood chemistry standpoint that might be helpful and guide our treatment. So I really got some of the standard blood chemistry that you would get for someone with a history of hypertension. So looking at a complete blood cell count, I looked at a comprehensive metabolic panel that looks at your liver and kidney function. I also wanted to look a little bit at vitamin D because she was supplementing with it. And just wanted to make sure this wasn't an issue. I wanted to look at her lipids, so things like cholesterol, the HDL. Also want to look at her iron. She was a postmenopausal woman who had not had her iron levels checked since the postmenopausal status. So something I recommend at least at one point, or if there's an issue, obviously continuing to follow it. I also want to look at her B12 and folate, given some slight tweaks in her diet. And with that too, I looked at basic thyroid, so just a TSH and free T4, really nothing more extensive than that without really, I didn't really have a reason that was, would warrant more extensive blood work. So as you can see, it's fairly limited in the beginning what I'm doing for this patient in terms of blood work. I also, at her assistant, decided to get an inflammatory marker, high sensitivity CRP. But if I go into my co-op service, one of these laboratory services, and I were to calculate up the cost of her blood work, we're in the hundreds. We're talking about maybe $150, $200, $250 at the most. So really reasonable testing. And once again, make that point that you don't have to go do super expensive testing in the beginning. And actually, some of this blood testing, when you do use other sources, such as co-ops, which I plan to use after my residency, you can get quite cost labs at cost, CBCs for $10, for instance. So we did those labs, and I had her continue on the diet, and a couple days later got her labs back. And realistically, when I looked at her labs, there's really nothing that stood out. Her lipids actually looked quite good. Her triglycerides were around 100. HDL was 55. Had no signs of anemia. Her thyroid function was slightly low normal, but not actually truly hypothyroid. Vitamin D was 35, which some people would argue is too low. I sort of say it's probably in a normal range. And her iron parameters were also reasonable. B12 and folate were also normal. So after doing that testing, and her high sensitivity CRP was 1.08, so slightly less than ideal, but not super elevated. So with that basic blood chemistry, I'm feeling pretty comfortable that this person, there's nothing normal that we need to go after that's telling me there's liver function that's impaired or kidney function that's impaired, or definitive hypothyroidism or major nutrient deficiency from this the basic blood work. So that's when I sort of feel comfortable. Okay, let's go create this therapeutic program for addressing your issues. And as I alluded to earlier, we're going to start with the gut. So her program, and like I said, this is in the very beginning, this is taken from Dr. Michael Ruscio's sort of stepwise clinical approach of, first dietary modification, and then are we going down a supportive GI pathway or more of an antimicrobial GI pathway? And given my concern for small intestinal bacterial overgrowth and a little bit of dysbiosis, I decided I wanted to go down an antimicrobial pathway. I also assessed the patient and said, well, how much of this are you invested in or wanting to do? And she was quite motivated and really wanted to use a few more additional products to kind of see if she could get a big effect in the beginning. So that being said, her initial approach, I decided to use a combination of a single herbal antimicrobial, a anti-biofilm agent. You guys are probably familiar with bacteria and other actually organisms can cause these sort of biofilms, as one is a kind of protective colony from other bacteria. That's also kind of protection from the antibiotics that we use. So I wanted to sort of target with an anti-biofilm agent, and also given her constipation, wanted to try a prokinetic. So three things. We have an herbal antimicrobial, a biofilm disrupting agent, and a prokinetic. And the biofilm disrupting agent you would in general give before the antimicrobial, the mechanism of, hey, let's disrupt the bacteria, then give the herbal, so make it be more effective. So those were sort of the three core products. Now, more supportive-wise, I was giving her 2 different probiotics and some enzymes to try with meals, as well as a special prebiotic. Because I was limiting her FODMAPs, which are sort of the natural prebiotics, I didn't want to go completely, without any, prebiotics, fibers, because we know they're important for gut health. So I used something that in the literature appears to potentially be helpful for in treatment of SIBO, called partially hydrolyzed guargone. So 2 different probiotics, did some enzymes with meals, and had her take this prebiotic fiber, a sort of specialized prebiotic fiber. Outside of that was her core gut, both kind of the antimicrobial component and the supportive GI component. I wanted to add at least a little bit of nutritional support. She had been taking some estrogen adaptogens because, remember, her symptoms were kind of primarily female hormone imbalance related. So I allowed her to continue taking those. I also wanted her to do a little bit of magnesium and cod liver oil. And given her vitamin D, I was happy with that level. I had her actually discontinue a bunch of these other medicines or a bunch of these other supplements, including CoQ10, red yeast rice, this calcium magnesium complex, a multivitamin, vitamin D, and a couple other things. So really eliminating a lot of things and saying, hey, let's put all of our focus right now on the gut and give you a little bit of magnesium. I'll give you some adaptogens for female hormone and take a little bit of cod liver oil, and let's put our emphasis there. focus again on the gut. And in more cases, let's eliminate things that have either marginal benefit, no benefit, or potential harm. So we're going forward with her with a very dedicated gut approach. And at this point, I was sort of saying 4 to 8 weeks being our first go at this regimen. So I had her come back 4 weeks later, and this is what was fascinating, even beyond what I had expected. She came back and was saying she was not having no more headaches. The nausea was almost entirely gone. She only had like one episode of vomiting very early on. Her hot flashes were going away. She was not having these night sweats. She was sleeping, was getting more restful sleep. All of these things beginning to improve within the first 4 weeks. And she, for the first time, said, I've had these symptoms for years and years, and I'm finally getting rest. And she, too, was kind of becoming a believer, because at first she was like, I don't see how these gut-focused therapies are really going to address my issues that seem more related to female hormones. Why aren't we doing more with the female hormones? And so I, was floored by her response. And she was so engaged and so motivated at that point that, we decided, well, let's continue with this regimen for another 2 to 4 weeks. And so we continued. I, at her insistence, did add, her energy was a touch low in the morning, so I did add a little bit of a methylated B complex, which I'd be on the fence about using in the beginning, given my concern for her small intestinal pathology and that we can have problems with absorption in the gut. So I did add on a methylated B complex for her, which she did actually do very well with. And as we went forward, utilize them for their distinct purpose. So in discussing with the patient, I decided, well, what's the most reasonable first thing to do? And for her, she really felt that the herbal antimicrobial was helping, the prokinetic was helping, and overall she was feeling better. So we decided, yes, let's start to peel back some of the food restrictions in terms of the low FODMAPs, because realistically, I want all my patients to have the most, or I should say, least restrictive diet possible for them, to enjoy life. I don't want people to have to restrict gluten or dairy, these things, just because it's a fearful thing or they think they're reacting to it. So we decided, hey, let's start to reintroduce certain foods. And actually peeled back one of the doses of the herbal antimicrobial and the antibiofilm agent. I kept the probiotics on because they were quite positive and wanted to continue that supportive agent with the plan to eventually get rid of the herbal antimicrobial. So over the next 2 to 4 weeks from there, so we're talking about 8 to 12 weeks from the beginning of seeing her, she is starting to phase out the antimicrobial. She's continuing to do well. She had a few issues with some of the reintroductions, but she was learning about things that she could tolerate or things that maybe weren't going to be right for her. And by the 12-week mark, she was completely off the herbal antimicrobial. She was continuing the 2 probiotics. She didn't really need the digestive enzymes anymore, and she was pretty set on her food template. She kind of reintroduced some of the FODMAPs and found the ones that were the most caused her the most symptoms. And once again, she had really sort of been empowered through this whole process and really was feeling that her symptoms were addressed. She was feeling more energetic, and she had a good understanding of what her body would need in any given moment to stay well. So as you can see here, I think this highlights a huge clinical win. Now, I could certainly go and find some cases where it's probably not this positive, so I don't want to get you to think that this is just a bias that everyone does well with this, or that I use this same program with everyone, because it's not personalized. But this does echo a huge clinical win, focusing on gut health and utilizing a stepwise approach, as outlined by Dr. Michael Ruscio. We really start to understand sequentially that we can do certain therapies to address underlying gut dysbiosis, as in this patient's case, and do it in a controlled manner without expensive testing. If we actually went back in and I looked at the total cost of her supplements and the testing, and even my time, which is probably the least expensive, given that I'm still a resident, we are in the hundreds of dollars still. We have not even broken $1,000. And, some people are getting $5,000 worth of testing before they even step out the door. And so I really want to make this point. I don't want to seem like I'm on a soapbox, but really focus in on how we, as clinicians in this space, are utilizing our resources. And this kind of leads me, segue to my final conclusions for folks, and saying, for clinicians, let's start to open our eyes, remain humble, and start to see what we can do for people in the beginning, focusing on lifestyle, and what it's going to be the sort of bad analogy, but biggest bang for someone's buck. How can we get more value out of our clinical evaluation of the person instead of simply having to rely on tests that may or may not be indicated and may not actually be addressing or identifying things that are the root cause of this person's issues? My personal opinion is saving some of that testing for later down the line if the person doesn't respond to initial dietary approaches, lifestyle approaches, or initial supplementary gut-focused approach. Use that testing when you're stuck in the mud and you need to get out of an approach that hasn't worked for 8, 12, 12 weeks or a few months with an individual. Also, I want to highlight, as a provider, myself, I am a family medicine resident. As a medical doctor, I have been humbled by recognizing that I'm learning so much from individuals with different clinical backgrounds. As I've been talking about here, Dr. Ruscio, he's a functional medicine provider, but he's a chiropractor by training. I've learned tremendously from a licensed acupuncturist, Chris Kresser. Two of my mentors locally, one is a DO, so a doctor, but a doctor of osteopathy. I've had a great clinical mentor who's a nurse practitioner. One of my local mentors in my residency is a clinical psychologist. So some of the people that are really impacting my life have different initials after their name, and I am not afraid to be in spaces with them to learn. And I think we all have to recognize that we need to do that more often. And it's not simply just working as a team, which can be beneficial. It's really starting to recognize people's skill sets and their experiences and what they have to offer. And not that you need to become them. I don't need to become the clinical psychologist, but they do have a lot to offer in terms of, hey, what can I do in my clinical approach? And really, realistically, we need to guide our treatments based off of what works. And so this will certainly sound like a soapbox comment, but the thing is, we can stay up to date with evidence base. We can read the journals as they come out, the New England Journal of Medicine. We can read JAMA. We can read the Annals of Internal Medicine, what have you. And I won't say that's a bad thing, but I kind of can make an analogy to that being somewhat to staying up with the celebrity news or staying up with current TV shows. I mean, you can stay up with something. You can be totally on what's being published in those things, but it may really not be that relevant. And actually, we need to be spending what little time that we do have outside of clinical experience looking at things that are going to improve our clinical expertise. And that's where I have found that the future of functional medicine review has been the most valuable. For $25 a month, I am getting case reviews like I've just outlined here, clinically focused case reviews, as well as what I haven't even mentioned, numerous research articles with thought-provoking reviews and commentary from Dr. Ruscio himself with links to the article. There's also even shorter clinical reviews about certain articles to go along with those in-depth reviews of research. And realistically, I don't have the time to go out and find these articles. So it is incredibly helpful for someone who I feel has a great competent background and unbiased perspective, as unbiased as possible, perspective of the literature, to go out, find these studies, and then create something in a packaged content that is sent into my inbox that I can look at and then utilize as a stepping stone to go out and read the literature, because I don't have all the time in the world to go find these things. And a lot of times people aren't doing this. So I wanted to find people like Dr. Ruscio who could help me to engage in the literature in a productive way. So some people probably might be upset by that comment, might be saying, well, I read this journal, I read this journal, this journal. Well, that is okay, but we have finite resources, we have finite time. And I've recognized that what's actually helping me more clinically is not staying up to date per se with the articles that come out in JAMA or the articles that come out in New England Journal. It's not that I'm not aware of them. I'm just not necessarily spending all my time focusing on them because I found other things that are actually guiding my clinical therapy and helping patients more. So, end of that soapbox comment. My last few comments I want to make are actually really directed towards patients. So if you're a patient listening to this and you're probably like, oh my gosh, this went all over my head, like this was all clinically directed, these comments are specifically for you. I want you to recognize that you do not need necessarily extensive testing to begin any form of treatment. You can start with lifestyle and address root imbalances without expensive testing, without expensive supplementation, and then improvise and modify that as you go along. It's incredibly important at the beginning to assess your resources, or what I refer to as your bucket. How much do you have to dedicate to? And there's numerous things that they can go to. Your resources can go to drugs. They can go to the doctor's time or the clinician's time. They can go to supplements. They can go to testing. They can go to food. And it's a finite bucket. So if we spend all of our money on testing, well, I wouldn't be surprised if you can't spend it on food, or that one supplement that might be helpful you're not able to purchase. So just be honest with yourself and recognize, where is my bucket right now? Also, from an energy standpoint, how much can I pour into myself, or how much am I supported by others to go in this healing journey? And as clinicians, we need to honor that and ask that and start recognizing it, because you know what? It's really the thing that has changed my clinical approach the most, is seeing how much I can do with as little as possible. So, last comment for everyone, but also, focus more for the patients. Do your homework. Seek guidance in clinicians and trust the individual, but don't think you can simply pay your problems away. The people that I've found that have the most money and on paper the most resources are oftentimes the people that do not get well for very different reasons. But you cannot simply pay your problems away, and it's okay to do your homework about who you will partner with. But I will certainly encourage you, once you have partnered, trust in them. If you've done your research and you've found the person that's right for you, trust in them, engage in the process. You will likely get better, or at least, in the very least, learn about yourself and how you can heal your body. So I hope everyone enjoyed that. It wasn't too much of a ramble. I want to do something a little bit different for today's show. And perhaps if you guys like this, leave some comments. I will certainly be willing to make some more case reports and kind of go through them in this format, or put them into a combined format of audio and text, as I put up a couple months ago. And yeah, like I said, this last comment again, I can't reiterate. Go check out Dr. Ruscio's Functional Medicine, Future Functional Medicine Review. It is an incredible resource, a monthly repository of case studies, research, evidence, clinical practice tools that you cannot find anywhere else. And it's $25 a month. I mean, come on, people. My medical school education cost $200,000. So I think $25 a month is pretty dang worth it. It's probably worth it for you too. So if you haven't already, check it out. If you're a patient, share it with your provider. Share it with someone else, one of your friends who might be a clinician. Share it with him. It is an incredible resource that I have been really honored to be a part of and to learn from. So with that, I hope you guys enjoyed the show, and I'll talk to you soon. All right, bye-bye.
Thank you for your presence and willingness to receive a new narrative, a passionate perspective, and perhaps a deeper sense of connection with our collective purpose. Please share this podcast with any and all that you believe will benefit from its intention to relieve one's doing and engage one's being. Please share your comments about the conversation on our podcast page and leave a review in iTunes so that the voices in this space can spread to all ears ready to receive it. Music credit goes to Dillingham for their song Vessel. Remain open, stay curious, and forever be love.
You walked on fire, and I know you tried.